Ed LeCare here from Sports Plus. Hey, today, so a patient came in with some pain in the cartilage down here, or what they thought was a cartilage. They'd seen their physician, x-rays, lab tests to make sure that there was nothing going on. I'm actually on the wrong side. This is the liver side. It was on the spleen side. But it was sitting underneath, and it was worse with exertion. So what can happen is the diaphragm, acting as a muscle, can get caught up in here, similar to like when you bring your hand overhead and you start to feel that little crunching in the scapula when you don't have good movement through there. So I'm going to show a self-release. I released this with her. To show a self-release for the diaphragm. And then what's really important concept is that anytime we release a muscle, we need to then stabilize it with a little bit of exercise. So I'll show that as well. So this would be anything with pain underneath here or underneath here that has already been cleared out by the physician. Okay, so you got to make sure that it's not a liver, kidney, gallbladder, pancreas, stomach. I mean, there's other things that can be going on. That's our job to rule that out. Once that's all been ruled out, then you can do some self-release. Okay, so that'll be the next clip. So what you're going to do is first locate your lower rib. So you can crawl it, crawl your fingers up that lower rib, all the way up. And then you're going to get to a point where there's a little divot. That's your xiphoid process. We want to be off of that. You're going to go back down into the soft tissue, into the meat. I'm going to use like a claw finger here. I'm going to come underneath, and then I'm going to take a deep breath, let it all the way out. Then I'm going to bend, and I'm going to bend and try to release my belly and get underneath that rib, and then take some breaths and getting some movement through that diaphragm. And then I'm going to come back out of it, take another deep breath, let it all the way out, move my hand a little bit further out laterally or to the outside, come underneath, and then take some deep breaths. And I'm going to keep coming out lateral. So I'm going to go all the way along that rib down to about what they call like front of the axilla or mid-axilla here. Not going to go too far deep because that's where your floating rib is. I'm going to stay right in that area. About maybe 3 or 4 breaths in each of those areas all the way down. And then on the next clip I'll show you the exercise to engage with that. All right, to finish up, we're going to do a little resistance exercise for your diaphragm. I'm going to use a TheraBand. You don't necessarily have to, but I like the TheraBand because it's going to give me constant pressure. I'm going to wrap this around my lower rib cage, and I don't have to tie it. I'm just going to give it a little bit of a squeeze here just to get some compression. And now what I'm going to focus on is belly breathing, meaning not breathing from up here, breathing from down here, but also feeling for expansion through my rib cage here because the diaphragm runs all the way along. So you need to put your hand on your belly, on your chest, make sure this hand here is rising first. The band gives resistance, so that way it's compressing, and I can feel that, get that feedback. I would do maybe 5 or 10 belly breathes from here, really feeling that expansion. Again, after I've done that myofascial release. You can do that maybe once or twice a day for a few days and see if that won't help relieve the symptoms of that feeling underneath that rib cage. Or that weird kind of breathing type. But you know it's a diaphragm issue, and it's with exertion, or when you're stressed, or when there's you've started to work out, or something that's really engaging you with more deeper and harder breathing. So I hope that helps. We're obviously here if you need us, sportsplusbayarea.com. Have a great weekend.